What is creatinine? Creatinine is a waste product that comes from the normal wear and tear on muscles of the body. Creatine is a chemical that your body uses to supply your muscles with energy. As your muscles use energy, the tissue that makes up your muscles breaks down. This natural breakdown of muscle tissue causes creatinine to be released into your bloodstream. This is when creatine becomes creatinine. Everyone has creatinine in their bloodstream. What is a normal level of creatinine? That depends on your age, race, gender, and body size. Creatinine is actually a waste product of creatine. The more muscle a person has, the more creatinine they produce. Levels of creatinine in the blood reflect both the amount of muscle a person has and their amount of kidney function. Most men with normal kidney function have approximately 0.6 to 1.2 mg/deciliters (mg/dl) of creatinine. Most women with normal kidney function have between 0.5 to 1.1 mg/dl of creatinine. Women usually have lower creatinine levels than men because women, on average, have less muscle than men. Other factors that may affect the level of creatinine in the blood include body size, activity level, and medications. Normally, creatinine is filtered out of your blood by your kidneys. If you think of each organ in your body as having a job, the kidneys are the filters. They're responsible for cleaning your blood. The material that's removed from your blood leaves your body in your urine. If your kidneys aren't working properly, then you may have higher levels of creatinine in your blood than you should. Looking at how much creatinine is in your blood is not the best way to check your kidney health. That's because the level of creatinine in your blood is affected by your age, race, gender, and body size. In other words, what's considered normal depends on these factors. The best way to know if your kidneys are working properly is by looking at your glomerular filtration rate, GFR. GFR is a routine lab that can be found on your blood work report. GFR is a calculation that includes your creatinine, along with your age, gender, race, and weight. Your GFR number will help your doctor know if you have kidney disease. You may have kidney disease if your GFR number is below 60 for 3 months. Above 60 with signs of kidney damage. Having protein in the urine is a sign of kidney damage. Do you need any other tests? Yes, another important test to check kidney function is a urine test. You will be asked to pee into a clean cup called a specimen cup. Only about 2 tablespoons of urine is needed to do the test. The urine will be sent to a laboratory, where a test called an ACR, albumin to creatinine ratio, is done. An ACR shows whether you have a type of protein called albumin in your urine. A normal amount of albumin in your urine is less than 30 mg/g. Anything above 30 mg/g may mean you have kidney disease, even if your GFR number is above 60. This test is also used to look at how likely it is that a person's kidney disease will get worse. This is called risk for progression. Having high amounts of albumin points to a higher risk. Are there any instances when creatinine alone can be used to determine kidney function? This is an important question. There is a difference between looking at creatinine in your bloodstream, called serum creatinine, and looking at creatinine in your urine, called creatinine clearance. These are 2 different lab tests. Serum creatinine is part of a routine lab report, creatinine clearance is not. Creatinine clearance requires a timed urine sample. All the urine you have passed within a specific time period, usually 24 hours, is saved, collected, in a container and tested. The result shows how much creatinine has passed through your kidneys into your urine. It helps show how well your kidneys are removing the waste products from your blood. Are there any symptoms associated with a high creatinine level? Kidney disease tends to be silent and, for many people, there are no symptoms in the early stages. However, as the disease progresses, you may experience a few symptoms. These can include swelling, fatigue, feeling tired, changes in how often you urinate, loss of appetite, nausea, itching. Swelling in the legs and shortness of breath may occur if water builds up in the body. Creatinine and chronic kidney disease. When there is kidney damage or kidney disease, and the kidneys are not able to filter waste efficiently, there will likely be a rise in creatinine levels in the blood. Dialysis is needed whenever kidney function is too low to maintain health. However, creatinine is just one of many factors considered when deciding whether or not to recommend dialysis treatment. Creatinine tests. Creatinine can be tested in both the blood and in the urine. These tests can help evaluate change in kidney function. Serum creatinine is a test that draws blood and sends it to a laboratory to be analyzed to find out how much creatinine is in the bloodstream. Knowing your serum creatinine allows your doctor to calculate your creatinine level along with your age and gender to determine your glomerular filtration rate, GFR. GFR is a measure of kidney function. If you know a serum creatinine level, you can determine the stage of CKD using the GFR calculator. A low GFR, just like an elevated serum creatinine, is not always evidence of kidney disease. Ask your doctor to help you interpret your results. Creatinine clearance, CCR or CRCL, measures how much creatinine is cleared out of the body, or how well kidneys filter waste. Creatinine clearance requires a combination of a urine test and blood test. Because the urine has to be collected over a period of 24 hours, the creatinine clearance is usually done after first evaluating the serum creatinine and calculating the GFR. Do I need to fast, not eat, before the creatinine clearance test? In general, you can eat normally before and during the creatinine clearance test. However, you may be asked not to eat overnight. Your provider may also ask you not to eat meat before the test. This could change the results because there's higher levels of creatine in meat, which would cause your body to have higher levels of creatinine during the test. Home remedies to naturally lower your creatinine levels. Creatinine is a waste product that's generated when you use your muscles. Eating lots of protein may also produce small amounts of this organic compound. Abnormal creatinine levels may be a sign of kidney disease. Creatinine levels can also rise temporarily from strenuous exercise or using certain medications like sulfamethoxazole, trimethoprim, or chemotherapy drugs. Furthermore, becoming pregnant or eating a diet high in red meat may contribute. Your body needs to clean your blood to function optimally. The best way to lower your creatinine levels is to treat the underlying cause. If your blood creatinine is high, it's important to work with your doctor to develop a treatment plan to address any medical issues that might be harming your kidney function. Along with your medicines and other treatments, ask your doctor whether the following lifestyle changes are appropriate for you. 1. Don't take supplements containing creatine. Creatine is a natural compound made in your liver. It's transported to your muscles where it's used for energy. When creatine is used as energy, it's degraded into creatinine, a metabolic byproduct. In addition to its natural form, creatine is available as an oral supplement. Some athletes use these creatinine-producing supplements to help enhance athletic performance. Anyone wishing to reduce their creatinine levels to improve their kidney function should not take creatine supplements. While creatine supplementation has been widely studied, there is a lack of long-term studies on people with kidney disease. Talk with your doctor before adding any supplement to your diet. 2. Reduce your protein intake. Research shows that eating large amounts of protein can increase creatinine levels, at least temporarily. In particular, cooked red meat can affect creatinine. The heat from cooking causes the creatine found in meat to produce creatinine. People following diets very high in red meat or other protein sources, including dairy products, may have higher creatinine levels than people who eat fewer of those foods. If you eat lots of red meat, switch to more vegetable-based dishes. Try swapping out beef burgers for vegetable patties, hearty vegetable stew, lentil soup. 3. Eat more fiber. More research is needed to determine dietary fiber's effects on creatinine levels. Nevertheless, one study showed significant reductions in creatinine levels in people with chronic kidney disease who increased their fiber intake. Fiber can be found in many foods, including fruits, vegetables, whole grains, legumes. 4. Talk with your doctor about how much fluid you should drink. Dehydration can raise creatinine levels. Fluid intake can also be an issue for some people who have kidney disease. Talk with your doctor about how much water and other fluids you should drink daily, as well as the best time to drink them. 5. Lower your salt intake. Diets that include excess salt can contribute to high blood pressure. Processed foods, in particular, are often loaded with sodium and phosphorus, which studies have shown potentially cause renal issues. Consider focusing on whole, unprocessed foods, and using spices and herbs to flavor your food when possible. 6. Avoid overusing NSAIDs. Over-the-counter painkillers like nonsteroidal anti-inflammatory drugs, NSAIDs, may be harmful if taken too often. Do not use them in amounts over the recommended dosage, especially if you have kidney disease. Talk with your doctor to determine the right treatments for pain and inflammation and how often to take them. 7. Avoid smoking. Smoking cigarettes can harm the body in a number of ways, including significantly increasing the risk of chronic kidney disease. Quitting can be a way to reduce the likelihood of issues with your kidneys that may increase creatinine levels. 8. Limit your alcohol intake. Alcohol consumption can be a tricky issue when it comes to kidney function. Some studies have shown that moderate alcohol consumption may help decrease the risk of chronic kidney disease. Other studies have shown that excessive alcohol has the potential to damage the kidneys. It can also contribute to conditions like high blood pressure and alcohol dependency. If you drink alcohol, consult your doctor about the safest levels for your health needs. Excess creatinine levels can indicate serious medical conditions but also be a temporary byproduct of certain lifestyle factors or conditions. If your doctor finds that your creatinine levels are high, changes to your activity levels and eating, drinking, and supplementation habits may help reduce them.